MEC is here with us. She will just take us through the media briefing for today. Welcome all of you. We will listen to what MEC will give to us, and then we will take questions afterwards. Thank you very much. Over to you, MEC.
Thank you very much. Good morning, Togozo. Is my camera on? I don't seem to see myself.
Yes, your camera is on, MEC, and it's clear.
Oh, all right. No, thank you very much, colleagues. Apologies for the late start. We had another program that we needed to attend to, and it ran just a little bit longer. So we really do appreciate the fact that you're here, and we apologize for being late. We'd like to start by thanking all of you for being part of this webinar, and to also apologize for the late starting, as I have correctly indicated. We do appreciate the fact that you are part of our webinar today, despite the fact that we have started, or we are right in the middle of our festive season. It is an indication of how serious we take you as part of our campaign and as part of our machinery in the fight against COVID-19. But the fact that you are also here is an indication that you take your role very, very seriously. And we really appreciate that. And we should thank you very much for being here. We have decided to convene this media briefing due to the significant rise in infections that we have noted lately, but due to the number of questions that we have been receiving from the different media houses. So we thought that let's have one engagement so that we are able to give you all the responses in one go, and you are able to get able to engage with us directly. We recognize and appreciate the power and influence that you have, and that is why we appreciate the fact that you have really been working with us towards this fight against COVID-19, and we appreciate your continued commitment in ensuring that you work with us as the Department of Health and as government generally. The fact that we are still we are now dealing with, as a province, still dealing with our fourth wave means that our numbers will continue to grow, unlike the numbers in provinces like Gauteng, which have already started declining in terms of the daily infection rates. In the latest 24-hour reporting period, which is at the end of yesterday, we recorded 2,496 new infections. The day before, on Sunday, we registered 4,135 new cases. Prior to that, which was Saturday, we registered 4,202 infections, while on Friday we registered a staggering 5,132 infections. On Thursday, a day before Friday, which is the 16th of December, the official start of the peak holiday season, we had registered 5,821 new cases. This was down from the 5,924 which was registered the previous day on Wednesday, the 15th of December. So as you can see, ladies and gentlemen, the number speaks for themselves, and really they are a cause for concern. 2 days ago, we did overtake Gauteng and became the province with the highest rate of infections. We do anticipate that this will keep on changing because of the small margin that separates the two provinces. But as we have said before, the increase in the new infections is not entirely surprising. I mean, the province of KwaZulu-Natal is a province that normally sees a lot of tourists during this time, but we also see a lot of compatriots that come from the province of KwaZulu-Natal coming back home from the different provinces where they reside or where they work. So generally, we would have expected that our infections would go up during the festive season, but it is the number that they go up with that becomes a cause for concern, a cause for concern for us. However, having said that, we also want to thank those who have come forward and got tested, because by doing so, they have removed all doubt and now know that what is their status. By getting tested and knowing their COVID status, it means that those with severe illness can be hospitalized and receive medical attention, while others will be isolated so as to curb the further spread of the virus. And those that have tested negative will continue to implement the non-pharmaceutical interventions of washing your hands, social distancing, washing your hands and sanitizing if you can, social distancing, and always wearing your mask. Indeed, indications are that although the dominant Omicron virus is highly infectious, it is not as lethal as the other variants that preceded it. However, that said, we are extremely concerned by emerging scientific reports to the effect that this variant causes more severe illness among the younger age groups compared to what we have seen with the other variants in South Africa. There is a remarkable number of children below 14 years in the new cases that we have registered from the past week or so. And it's remarkable because we have not seen the same trend in the other variants. In terms of deaths, we have not seen a high number, but in the few that we have recorded, all age groups are affected from 4 months upwards. That is yet another strong reason for parents to ensure that their children who are aged between 12 and 17 years are vaccinated. So we are really appealing to parents and guardians to heed this call because we believe it is in the interest of their children, but it is also meant to keep their children safe. During this 7-day period under review, we have sadly lost 42 people due to COVID-19. While this is thankfully a lot lower than what we saw during this, the same or corresponding period last year, 42 lives is still 42 lives too many, as this number includes breadwinners, mothers, fathers, sons, and daughters, and a number of people who we all love. These 42 deaths have brought to 14,868 the number of people who we have lost due to this pandemic. And may their souls rest in peace. Ladies and gentlemen, these numbers are a grim reminder that COVID-19 is still here and it still kills. This means we need to change how we do things, but it also means we need to continue to adhere to the non-pharmaceutical interventions as has been indicated and has been requested. We can never mention this frequent enough. We say sanitize, wash your hands with water, with soap, or sanitize if you can, but most importantly, also maintain social distancing. Sadly, ladies and gentlemen, while people continue to die due to COVID-19, and while we continue to see a rise in the rate of infection, we have noted with great concern that even fewer people have been coming forward to get vaccinated, and that is a serious worry. So instead of growing, our vaccination numbers have actually dropped in the recent weeks, particularly when we started to get into the festive season. We've moved from around 20,000 vaccinations per week to less than 10,000 infections. So far, our province has vaccinated 2.7 million people, while we still have a further and a staggering 4.4 million people to vaccinate still. The age groups of 12 to 17 years and 18 years to 34 of age are where we've registered the lowest rates of vaccination at 2.9% and 23% respectively. And yet these are the groups that make up quite a big proportion of our target population. While we once again encourage those who have flu-like symptoms to get tested, we urge all those who have not been vaccinated to come forward and get a jab. This will enable their bodies to fight the virus in case they get infected. It will also reduce their risk of severe illness, hospitalization, and subsequent death. This will also move the province and country closer to achieving the population immunity that we have been talking about. Again, vaccines are safe and are not linked to the 5G technology. They do not turn you into a satanist or a cannibal who feeds on human flesh. The vaccine also do not cause infertility or impotence. In South Africa, there have not been any deaths that have been linked with COVID-19 vaccination. And we have not seen any results that are speaking to that. At some point as a society, we must choose whether we want to believe scientists who have studied what they are talking about or scientists that come from the streets. We've also noticed that from a racial perspective, Black Africans in particular have not been forthcoming in large numbers, and when compared with people of other races in the province. This is why we are intensifying our vaccination efforts in townships and rural areas. But our efforts are really only as good as people are willing to respond. If people do not respond, our efforts are really going to be futile. We have gone beyond the awareness phase. We believe that everyone knows that there's a vaccine and that it is freely accessible. We now want to get to a stage where we convince people to change their behavior and get vaccinated. But we also convince people that they should not listen to information that is not verified, to information that is spread on social media that does not have credibility. We're also looking at finding ways to remove barriers to physical access to our vaccination sites. This we will do by establishing, and we have started establishing, vaccination pop-up sites in different areas, vaccination drive-throughs and sites, drive-throughs and so forth. We have started with pop-up sites, and we are implementing them in a number of towns, streets, and areas that are populated or are overly populated. We have even established pop-up sites in the beach so that people, while they come and enjoy themselves, they can also get an opportunity to get vaccinated, and we are bringing the vaccine closer to the people. We want our people to turn their backs on the many myths and false information that has been spread about COVID-19 vaccines, and to accept that there is nothing evil about these vaccines, but they are rather meant to save lives. We are really pleading with the public to get vaccinated because there is sufficient evidence that COVID-19 is going to be with us in the foreseeable future, and no one knows how severe future variants will be. We also encourage everyone, including those who've been vaccinated, to avoid crowded places and to adhere to non-pharmaceutical interventions, as I have indicated earlier on. But they must also ensure maximum ventilation as much as possible where they are gathered, and regularly wash their hands as indicated with soap and water if you do not have an alcohol-based hand sanitizer. With that said, we must also register our concern about the number of people gathering in large crowds without wearing masks, as well as taking other precautionary measures. Of course, when people are in large groups, indoors and partying, it becomes impossible to adhere to social distancing, for instance. Many might also find it difficult to sanitize their hands. We therefore want to appeal to all our visitors and those that are coming back home for the holidays, but everyone else who live in KwaZulu-Natal, to keep the importance of vaccination at the top of their minds. And secondly, to ensure that they behave in a way that will not make it easy for them to get infected or for them to pass the virus to other people. This applies especially to vulnerable family members, friends, and neighbors who might have underlying medical conditions and are therefore at increased risk of suffering complications due to COVID-19. Most importantly, with the Omicron variant, we are seeing an increasing number of people testing positive who did not have symptoms at all. This once again underscores the need for us to behave in a responsible manner. As we wrap up the year, we want to reiterate our call to fellow citizens to get vaccinated, stay safe on the roads, and be responsible when they're having fun, and take all the precautions that will keep you safe from acquiring and spreading the deadly COVID-19 virus. On the roads, if we all adhere to the speed limit, keep our vehicles roadworthy, and refrain from drunken driving and overloading, we will prevent road crashes. By extension, this will lessen the burden on our healthcare system because trauma cases will be reduced, including our healthcare professionals who have had their hands full since the emergence of COVID. So if we stay alive on the roads, our healthcare professionals will only focus on those that are sick and those that have been infected with COVID-19. So once again, in the process of us being excited and happy during the festive season, let us remember that sexual responsibility is extremely important. It is important that those who are old enough to be sexually active should take care when they do so, and they must use protection at all times. Condoms must be used. They must be used because they are also freely available, and there are no questions asked when you need condoms. The advantage now is also the fact that there are female condoms, which a woman has a right to utilize should their partner not want to use the male condoms. So please, we are pleading, do not get carried away. Let us be responsible and not find ourselves with babies called Ovelapi no Putalienzega come September, because that is when our labor wards are the busiest in the province with babies that were conceived during the festive season. As we close, we wish all of you a safe December holiday season and a happy new year. Please take care of yourselves and take care of your families. Make sure that you implement the non-pharmaceutical interventions of wearing our mask, washing of our hands, and social distancing. Thank you very much, ladies and gentlemen.
Thank you very much, MEC. I will now request the members of the media by the show of hand to ask their questions and engage the MEC accordingly. I am noting, Umawande, your hand is up. I would like to take at least 3 or 4 questions at a time. Mabaso, you will be the second one. And is there any other person who is struggling with showing the hand? You can unmute and then I'll note you. Narisa Submani, you are the third one. Can I also check whether do I have the 4th person? I'll take Mawande first. Mawande, if you can open your camera so that you can see, or you can just ask your question. Thank you very much.
Okay. Thank you, Mapisa. Good day to everyone. Good day, MEC. MEC, could you please just give us an update in terms of the staff complement in the health facilities? We spoke to the Public Servants Association and they noted that there's an increase in the number of healthcare workers contracting the virus, which is then causing a situation where you have less staff working. That also affected the RK Khan Hospital, where a backlog was created over the weekend with regards to COVID testing and so forth. So could you please give us an update as to what are the staff levels and what is the contingency plan to ensure that there's adequate staff to deal with whatever health-related issues may arise?
Okay.
Thank you very much, Mawande. I'll then move to Nhlanhla Mabaso. You can continue, Nhlanhla. Nhlanhla? Okay, it looks like Nhlanhla is struggling. I don't know whether you are unmuted, but you are not speaking. I'll then move to Narisa whilst we're waiting for Nhlanhla to sort herself out.
Hi, can you hear me?
Yes, we can hear you very well.
Fantastic. Considering that KZN is a province where domestic tourists flock every festive season, and the MEC has highlighted that they've seen gatherings and parties without masks, shouldn't KZN then be leading the charge in terms of imposing restrictions on the unvaccinated populations, because this is where the country is heading in terms of mandatory vaccines? So just wondering, when it comes to the festivities and festive season with visitors, are there any plans in place, or are there any measures to restrict the movements of either unvaccinated people, or to check if people that are coming in are vaccinated, which will certainly help in terms of getting the numbers back up?
Thank you very much. Let me check with Nhlanhla. You can speak, Nhlanhla. I see you are unmuted.
Can you hear me now?
Yes, yes.
Okay, greetings. Greetings, colleagues. Greeting, MEC. I'm Nhlanhla Mabaso from Eyewitness News. My MEC is on the issue of healthcare workers. About 2 months ago, the province had about 20,000 healthcare workers that were not vaccinated. So I want to know how far is the department in this regard? Have you tried at least convincing some of those to get vaccinated? And if you have, how far is the process going? Like Umawanda has mentioned, as to how this affects the number of staff that has to attend to patients that are attended. But also, MEC, looking at the high numbers of holiday makers that are making their way to KZN and of course for our beaches, what is the Department of Health doing in this regard to ensure that maybe they are vaccinated, or of course to make sure that they prevent the spread of the virus in this regard? Thank you very much.
Okay, thank you very much. We will take this first round, MEC, then we will allow for the second round afterwards. Over to you, MEC.
All right. Thank you very much, Dozo, and thank you very much to the colleagues for those questions. Maybe let me start with the questions from Tlantla. The first one is, we have seen about 20,000 health workers that are not vaccinated, and these are health workers that have not been vaccinated right from the beginning. Of course, we do not have the mandate to force anyone to vaccinate, but we can only appeal and try and convince them. This is something we have been doing and something that we are continuing to do, to engage with them and make sure that they understand the importance of the vaccine, and and try and get them to agree to getting vaccinated. But as you correctly indicate, we cannot force them to get vaccinated because that is not the law in South Africa. We can only speak to them, and we have been continuing to do that. We are slowly seeing a decline in the numbers of those that have not been vaccinated, but there are not very sharp. It's not a very sharp decline, so we will not be able to see a huge difference overnight, but we are gradually seeing a number, the numbers that are of health workers that are not vaccinated going down. What are we doing about the holiday makers that are on our beach to make sure, or well, in our province and in our beaches, to make sure that they get vaccinated? As I indicated, one of our strategies in ensuring that we get everyone who's in the province to vaccinate is to ensure that we have pop-up sites in the different areas, particularly in areas that are busy. In other malls, we have been able to put up pop-up sites there so that when people go shopping, they can just pop in, get vaccinated, and continue with their holiday shopping. We have been able to do that. We have been able to put up pop-up sites, and we continue to do so in busy streets in the different towns, particularly towns that have a lot of visitors. But we've also put up pop-up sites on the beach or in the beaches themselves so that people are able to come and get vaccinated. I must say, however, that we have not seen a very enthusiastic uptake on the beach for people to come and vaccinate. We started putting up pop-up sites on the beach on Friday, and from Friday to Monday, we vaccinated only about 5 or so people. So, that tells you that people are not very excited about vaccinating, even though we make sure that people are aware that we are on site. People must come and get vaccinated. We've not really seen an appetite for actually for the vaccination, but we will continue to make sure that we go to the areas where people are and make the vaccine accessible so that people don't complain about not being able to access the vaccines themselves. Mwanda was asking a question about the staff complement. Where are we firstly in terms of the health workers infections? We really have seen that in the last few days, or since we started the fourth wave, our health workers have again began to be infected as well. But the difference with the infection this time around is that while we get a positive result in terms of the infection when one tests, but they have not, or majority of them have not been as sickly as they were during the previous December. Of course, that doesn't change the fact that they still have to be in isolation, therefore they can't be in their workstations. And as a result, we have then decided that we will have teams that are going to be roving around. We will have teams, particularly in the small facilities like your clinics, where we often don't have a big number of health workers. So we will have teams from districts where in one clinic, if there's a bigger number of health workers that have been infected, and we have a roving team that will go in and assist so that that facility does not close down. But we also do the same in the different hospitals, because each district will have a pool of health workers that have been employed during or utilizing the COVID-19 contracts. So where there are shortages, we are able to put in health workers that we take away either from the district office or from that particular pool, and we are able to reinforce there. The issue of RK-CAN, it was a matter really that was relating to the infections of the NHLS, with is the National Health Laboratory, and it is the matter that did not just affect RK-CAN, it affected a couple of the other sites of NHLS, and as a result, it amounted with RK-CAN having a bigger burden, because King Dinizulu and Prince Mshieni had a lot of their own NHLS staff being infected, and therefore those facilities had to close and everyone else had to come to RK-CAN. But we are working and with the officials from NHLS to make sure that we are able to get the systems running. But as of yesterday and today, we think our systems are going to be back, and they are going to be operational ordinary, are going to be operating ordinarily as they would ordinarily, because all the other health workers that had gone on isolation, some came back yesterday, some are going to be coming back today. So do we have enough staff? Well, not as we don't have enough staff in as far as we would like to have. However, we have sufficient health workers to be able to run the system so far, because we are running out of beds as well. Well, Narisa was talking about the mandatory vaccine. Should we not be leading the charge as the province of KwaZulu-Natal? Look, the issue of mandatory vaccine is a constitutional matter, and it is a matter that is discussed, and the discussion should, and correctly so, be led by the National Department of Health, because South Africa is not a federal country, nor is it a federal state. So the National Department on constitutional matters leads the charge and leads the conversations in relation to that, and we will make sure that we follow their directive. There are private there are private businesses who will then decide on their own that if you want to get a particular sale item, for instance, you can only be able to get it if you have vaccinated, and that is something that they do on their own. But as a government, we have a responsibility to adhere to the Constitution, and the Constitution so far does not speak to mandatory vaccination. Thank you very much, Dogos.
Thank you very much, MEC. I will then take the last round if there are media houses that still want to get some clarities or want to ask questions to the MEC. With a show of hand, those who are struggling to put their hands up, you can unmute and indicate that you want to speak. It looks like, MEC, you've clarified everything very well. People have no questions, and I think in the next 3 days we won't have any media queries, because you are here now. They always want you, and now they can't, they don't want to ask questions when you're here. So we are taking a leave for the next 3 days. This is the last round, colleagues from the media. If there is no one who have a question, I will then want to declare this media briefing closed. But let me check with MEC. Do you have anything to say to close?
Also, thank you very much. I think I would just like to say a few words in isiZulu so that everyone also gets to understand. Okokuqala nje esifisayo ukusho ukuthi njenge province yaKwaZulu-Natal, nathi province yaKwaZulu-Natal sesifikile kwi-4th wave, kodwa futhi siyabona ukuthi inamba zethu zalabo ababa infected usuku nosuku ziyakhula, sibe sibona ukuthi ezaseGoli ziyehla. Siyakwazi ke lokho, siyaqonda ngoba siyazi ukuthi baningi abantu abavakashayo la eprovincini yaKwaZulu-Natal okwenza ukuthi mhlambe ku-contribute noma yes kunezezele ekutheni iy'namba zethu zikhuphuke, kodwa siyazi futhi ukuthi bakhona abantu bakithi abahlala la eprovincini yaKwaZulu-Natal kodwa abasebenza kwamanye ama-provinces. So njengoba-ke kuyisikhathi samaholide, abantu bonke bayabuya emakhaya, abantu bonke bayavakasha futhi eprovincini yaKwaZulu-Natal. Siyacela-ke kodwa sesikubonile konke lokho ukuthi abantu bakithi abaqhubeke balandele umthetho, balandele lokho esikubiza ngokuthi ama-non-pharmaceutical interventions, okusho ukuthi umuntu akagqoke imask ngaso sonke isikhathi, ageze izandla ngamanzi anensipho uma engakwazi ukusanitizer, kodwa sanitize uma ngabe kwazi. Siphinde uma sihlangene sibe nayo into esiyibiza ngokuthi social distancing, ukuhlala ngokugqagqelana ukuze singagcini sithelelene. Siyacela-ke abantu bakithi bagade lokho, baqikelele nanoma uma sisemakhaya nakuyile ikhathi ezinje siba nayo imicimbi, sibe nayo imisebenzi, sibe nazo zonke imicimbi yokujabula. Siyacela ukuthi emicimbini leyo uma siba nayo abantu abawagqoka ama-mask uma ngabe behleli, uyikhiphe nje uma ngabe udla noma uphuza amanzi noma uphuza into i-cold drink bese uyayibuyisela imask, sithi nahleli sixoxe siyigqokile. Kodwa noma sihleli sihlale ngendlela yokuqhelelana ukuze singathelelani, sisigeze izandla ngaso sonke isikhathi, singagezi izandla endishini eyodwa ngoba ngendlela esijwayele ukwenza ngayo, kodwa kufuna sigeze izandla sithela amanzi ahambe, ngoba uma sigeze izandla endishini eyodwa kusho ukuthi umuntu mangabe benalo igciwane egeza izandla zakhe lapho uzobe ethelela nabo bonke abanye abageza izandla lapho naye. So siyacela ukuthi abantu bakithi baqhubeke bawulandele umgomo lo obekiwe ukuze sikwazi ukuthi siphile, sikwazi ukuthi siqhubeke nempilo ngonyaka ozayo, singene unyaka ozayo sisaphelele sisonke. Siyabonga kakhulu Ntokozo, bengithi nje angiyichaze ngaleyo ndlela ukuze nabantu bakithi bakwazi ukuthi bawuluzwe kahle lolu daba luqhamuka kuthina.
Thank you very much, MEC. I saw Ukongta trying to unmute. Did you want to ask a question? It's Gangati R. Or it was just a mistake? Okay, I'll assume it was a mistake. Then if there are no questions, I would like us to declare this media briefing closed. Thank you very much, colleagues. Have a safe and happy New Year.
Thank you.